Good morning, everybody, and welcome to our spring meeting. We're so excited to have you here. I was going to say, my name is Rachel Schramm, and I work, you probably get a lot of emails from me, but I am a program manager over here at the Cancer Consortium. And on behalf of our team, we are just so excited to have you all here today. We have about 180 participants registered, so it'll be a very full virtual meeting. But do feel free to make yourself comfortable, take breaks when you need. And obviously, we'd love to see your faces, but also understand that you're busy and listening as well. Just a couple things to keep in mind today. Let me advance here, maybe. Today's meeting is going to be recorded, and we do plan to share the recording through YouTube and send it out in an email afterwards. We are going to go ahead and disable AI note takers and remove them just to keep everything running smoothly. If you haven't already, please go ahead and use our chat feature to introduce yourself with your name, your role and organization, just to help everybody get to know you. I was telling folks earlier, I've been obsessed with the Artemis 2 space mission, as I know hopefully a lot of you have been as well. So our little attendance question is, if you had to take a selfie, if you have to choose between the moon and the Earth, which one would you choose? Also, in looking at our registration data, we know that about 40 out of 180 of you are new to the consortium. So we just wanted to welcome you. And if you wouldn't mind just indicating a little star as you introduce yourself in the chat, just so that we can know who you are and be able to recognize your name and welcome you as well. So one small change to the agenda that we have, our meeting is going to run until 1 o'clock. But we did build in a short 15-minute break, and that will be around the 11:45 to noon timeframe. So just in case you need to build for that. And now I would like to give a warm welcome to our Executive Director, Kelly Wells-Sittig. Welcome, Kelly.
Thanks, Rachel. I'm distracted by looking at everybody's names coming in to the chat. Thank you all so much for being here. We're looking forward to spending a good few hours together. So thank you for taking time for our spring meeting today. It always provides energy, I know, to our team to gather together as a coalition and to be reminded, of course, as I think I say every meeting, that the strength of the Iowa Cancer Consortium truly lies in our collective impact as a membership, as a group. Your expertise, your partnerships, your commitment to reducing the burden of cancer for all Iowans is really what makes the Iowa Cancer Consortium what it is. Just a few weeks ago, I was getting ready to read one of our newsletters and the blog posts that go along with it. And I was completely taken aback by the variety of the blog posts, the authors, and it just was such a really great reminder of how vast and talented and diverse our membership is in experience and in expertise and an interest area. Rachel, you can advance to the next slide if you would. We had Catherine Strobach from Triage Cancer write to remind young adults of their rights and options as they face cancer. And Emily Hoffman described finding her own young adult cancer survivor community. Heather Wilson shared an example of citizen science working through Nitrate Watch and the Isaac Walton League. Kinsey Harder from SafeNet RX, which is a regulated drug donation program, shared how certain eligible medications can be safely donated and redistributed to cancer patients who need them most. Angela Webb told her meaningful story of being a young mother facing colorectal cancer. Lara Holdley helped us celebrate Women's History Month and the role of women as caregivers. And Mark Rium wrote a beautiful post about the caregiving role of young people growing up with siblings with cancer. And this is just from 1 or 2 months of blog posts. I hope it piques your interest. I really would encourage you to take a look at our blog and get familiar with some of the wonderful Iowa Cancer Consortium members who are writing posts, and maybe consider if you have something you want to contribute to as well. Today, part of my role is to share a brief update on the consortium, where we're making progress, what's new, where we're headed next, and reflecting on the stories and information shared by these authors and consortium members just felt like the right place to start because it truly is a celebration of our network. Next slide, Rach. So by now, you know that we are operating under our fiscal year 26 through 28 strategic plan, which was shaped through extensive member input, including surveys, feedback sessions, and board and staff discussions. The plan is intentionally flexible, like almost everything that we do here. Like the Iowa Cancer Plan, it isn't about checking boxes. It's about helping us focus our collective energy where it can make a difference right now and where it's meaningful to you as members. The blog posts that I just shared, stories from Iowans who are part of the consortium, are one way you're seeing that plan come to life. Our role here at the consortium is to help you share your stories, lift up your work, and ultimately connect with others. When we put a call out for member authors to our blogs, the response was wonderful. So please continue to reach out to our staff when you have stories or information or practices, lessons you've learned, something you want to brag about, and new evidence to share. We would love to help you distribute that. One of my colleagues will drop a copy of our working strategic plan that includes some progress to date if you're interested in a deep dive into how we are working to implement it. And as we move forward, the plan has us continuing to build connections and a representative network to celebrate and amplify the work you're doing, to convene like we are doing today through high quality events, and to protect trust, neutrality, and open collaboration within cancer control here in Iowa. You'll also find the cross-cutting areas identified in our strategic plan woven into our programming, communications, grants, and policy discussions. And those cross-cutting areas are behavioral health, risk factors and prevention, screening and early detection, environmental risk factors, reducing barriers to healthcare access, and policy and advocacy. Of course, the financial health of an organization is critical to its work. And I know that we have sent you as members many updates over the past year or so about the state of cancer control funding and funding for the consortium. I'm really pleased to share that we were awarded the Cancer Control Coalition and Cancer Plan Management contract from our partners at Iowa Health and Human Services for another 5 years, starting July 1st. This is our foundational contract that allows the consortium to continue serving as Iowa's comprehensive cancer control organization and supports our core functions, including coordinating the Iowa Cancer Plan, which, believe it or not, it will soon be time to start thinking about revision within the next year, administering grants, convening partners, and more. So thank you to our partners at Iowa Health and Human Services for hanging in there with us over the past year. I know everybody has been concerned about funding. For the moment, things seem to be on an okay trajectory. So thank you to everybody. And we also want to thank our funding partners at Genentech, AstraZeneca, and Gilead for their investments in annual state cancer control as well. Diversified funding is incredibly important, especially right now. Our staff team remains stable, engaged, and closely aligned with our strategic plan and the Iowa Cancer Plan. We're prioritizing sustainability both organizationally and personally so that staff can continue to support members effectively and responsibly. Responsively. We hope to be able to grow our staff in the upcoming year, but we are waiting to ensure a couple financial pieces still fall into place. We will keep you posted as we know more. And then policy continues to be a key systems level lever for cancer control here in Iowa, as I think most folks recognize who are here. And it's certainly an interest area for you, Iowa Cancer Consortium members. I'm pleased to let you know that last week we hosted a gubernatorial forum for governor candidates here in Iowa to learn about key cancer control issues. The video of the presented information will be available publicly. Candidates for governor here in Iowa will receive a survey also asking for their thoughts and policy plans on several cancer control issues. And we will publish their answers and share them with you in time for you to make decisions for the primary election coming up. While the Cancer Consortium continues to remain nonpartisan, does not lobby, we know that our members play an incredibly important role in ensuring cancer prevention and control are part of statewide leadership conversations. Thank you for that. And of course, our policy work group exists to monitor relevant policy developments, share information, and build shared understanding. Again, not to lobby or take positions on legal issues. That disclaimer remains important to us. Members can stay informed through our work group meetings, summaries, and policy updates in our blog newsletters while making space for many different opinions and positions. If you're interested in participating in the policy work group, let us know and we'd be happy to get you connected if you're not already. Now, we actually have quite a bit to update you on briefly, though, about open opportunities here at the Iowa Cancer Consortium. First, the Iowa Cancer Plan Implementation Grants, our annual grant mechanism for fiscal year 27 right now, is currently open for proposals to support collaborative projects based on the Iowa Cancer Plan. Required letters of intent are due April 30th, so you have a little time. And then full applications will be due May 20th. Again, that letter of intent is required in order to submit a full application. And we always like to mention with these that our staff is here to help you, provide technical assistance, talk to you about the grant mechanism and ideas you might have. These grants are externally and independently reviewed, and then our board of directors makes final funding decisions. So our staff is available to be a resource to you through this. Please take advantage of that. We also have survivorship grants open, also in a partnership with Iowa HHS. These seek to address quality of life and long-term impacts of cancer, specifically building support networks for cancer survivors and psychosocial support for cancer caregivers. Applications for this opportunity are also due May 20th. And Rachel, I think a couple more slides. And then our sunscreen initiative, one more, there we go, remains a simple evidence-based prevention opportunity to anyone in partnership with the University of Iowa Melanoma Program. This is where community groups, events can apply for up to 3 gallons of sunscreen to use throughout the summer, again, for events at recreational settings, for daycares. Really, the sky's the limit with these. It's a very simple application. It is due April 24th, so you have a few more days if you want to sneak an application in. And again, this is an evidence-based way of reducing exposure to UV rays. And finally, we are seeking board of directors nominations as we do annually. This is a meaningful leadership role here for the Iowa Cancer Consortium, and we encourage nominations that reflect Iowa's diverse and lived experiences with cancer, professional experiences and backgrounds, geographic locations. Nominations are due May 8th. There was an email that was sent out yesterday, actually, about that, where you can find more information about nominating yourself for our board of directors and what that might mean if you're interested. And then in closing, thank you again for your collaboration, your leadership, and your commitment to cancer prevention and control in Iowa. This coalition works because of you, and we are so excited about what we'll continue to accomplish together. And now we get to move into hearing about so much great cancer control work that is happening across the state. And it's my pleasure to welcome our panelists for our first session, which we're calling Local Leaders, Statewide Impact, Cancer Initiatives Across Iowa. These presentations are current recipients of Iowa Cancer Plan Implementation Grants, funded July 2025 through June 2026. Each presenter will have about 10 minutes to share their project, and we will hold all questions until the end of their presentations, but there will be time for questions and answers, so take note of your questions. Please use Zoom's question and answer Q&A function to submit questions. You can also use the chat, and we'll do our best to monitor that as well so we can get your questions answered. Our first presentation will be from Kristina with the Iowa Medical Society, followed by Alexis from the American Lung Association, and then Jessica from Iowa Community Hub. Kristina, the floor is yours. Welcome.
Thank you so much. It is an honor to be here today and to talk a bit about a fantastic project that I have been blessed to be a part of. I'm just one of many partners on this project. So thank you to the Iowa Cancer Consortium for your continued support. But as Kelly said, my name is Kristina Seier. I'm with the Iowa Medical Society and also serve as the executive director for the Iowa chapter of the American Academy of Pediatrics. It's not very often that I get to wear both hats, so I'm excited to talk about this project today. Okay, it's just me today, but I'm one of many folks on this project, so I don't have to introduce anyone else. But I do want to talk a bit about what I'll cover. So explaining how culturally appropriate cervical cancer prevention education can both reduce stigma and increase HPV vaccination uptake in Spanish-speaking communities, which is our focus on this project thus far. Really showcasing the why and how of these cervical cancer chats that we provide to different communities across the state, and identifying strategies for building trust-based partnerships between community organizations, healthcare providers, and public health agencies to both improve vaccine rates and health education access across.
In return, we provide local health departments with recommendations for distribution, educational and promotional materials, a distribution tracker, and a follow-up template. And then we also provide them with utilization rates over time. This year, we also collaborated with the Energy Association of Iowa Schools, or EASE, to support radon testing in homes, but also in schools as well. So we'll talk about homes first. We offered free radon test kits to school districts that are working with EASE this year. So if a school district was signed up to work with EASE to test their school building for radon, they were offered free radon test kits with the intention to distribute them to their school staff or maybe other community members, parents, for them to test their homes. So the idea was we're working with schools. While you're testing your school, you should also test your home. So we distributed 1,685 radon test kits to 41 school districts across the state of Iowa. And along with their test kits, schools received some printed copies of our Iowa Radon Rat Card, which we have a lot of if anyone wants those. Some digital copies of additional radon handouts that we have on our website, and then a link to Radon Basics, which is a self-paced learning course that the Lung Association has. We distributed test kits to 29 counties across the state, and 15 of those counties represented our priority target counties. I don't actually have utilization calculated quite yet for these. We were working with EASE to kind of coordinate having them test their homes when the school is tested, and we receive results about a month delayed from the lab as well. So that's something that we'll be collecting before the end of the contract that we'll be able to share. We also worked with EASE to support radon testing in school buildings. As some of you here may know, EASE facilitates the school radon training and support system. That is the only Iowa-based and HHS-approved radon measurement training course for Iowa school district employees to test their buildings for radon. So in late summer and early fall, we facilitated a digital advertising campaign in some target counties that were identified by EASE for areas that haven't tested their school yet to promote their training and help get schools signed up.
With some separate funding, the Lung Association launched the Clean Air School Challenge this past summer. And this program helps meet schools where they're at in their indoor air quality journey. It also provides mini grant funds for schools to support assessment and remediation of indoor air pollution, such as radon mitigation. So that was operating, and we really used this contract and this partnership with EASE to help connect schools in Iowa with this program so that they could get funding for radon mitigation. That is an area that a lot of states don't have funding for to actually provide schools with that next step. So this program was shared with schools that were testing for radon this year with the help of the Energy Association of Iowa Schools. And we have 6 schools in Iowa so far that have joined the program and are going through the steps. And then lastly, I just wanted to throw this one out here. This was not done with funding from our contract here, but we did also work with Julie from EASE to host a webinar that was nationwide about radon testing in schools. So you can also just find that if you'd like. I know a lot of you are connected here with that organization too. So any of these resources can be found at lung.org/cask. And then we have the Energy Association of Iowa Schools website on here as well, energyaas.org. All right, just a little bit left. So in preparation for National Radon Action Month, we conducted outreach to healthcare professionals in the state of Iowa. So we successfully shared resources through the Iowa Academy of Family Physicians. We reached around an estimated 2,000 plus physicians through that. And then we also did direct outreach to 52 local health centers. We also promoted information to the Iowa Nurses Association and the Iowa Society for Respiratory Care. And we connected with family physicians, radiologists, physician assistants, respiratory therapists, and more. We shared 2 main resources. The first is a radon reduction toolkit for healthcare professionals that includes a peer-to-peer video, a decision support tool, a patient handout, a patient video, and a healthcare professional handout. And then the second resource is a new continuing education course titled Invisible Risks, the Health Impacts of Indoor Air Quality, and it includes an entire module and case studies on radon. And the course is completely free and offers a 1-hour continuing education credit. So we shared all of these resources with all of those healthcare professionals. We did share resources statewide through the Iowa Academy of Family Physicians, but we did target those 52 health centers were in 17 different counties, and 6 of those counties represented our priority target counties. And then this is an example of some of the resources that we shared. And lastly, the Lung Association facilitated some radon awareness messaging during National Radon Action Month and surrounding winter months. So during January, we connected further with the Iowa schools that we had sent radon test kits to share information about the Iowa Radon Poster and Video Contest, the Clean Air School Challenge, of course, like I mentioned, and then any other statewide radon initiatives or materials that we thought might be helpful for them. We also developed and distributed a statewide press release during January that encouraged residents to test their homes for radon. And we facilitated a digital advertising campaign that promoted radon testing in both homes and schools. You can see some metrics and engagement from that campaign here on the screen. And that is all I have for you all today, but I did want to mention that the Lung Association does a lot of different work in Iowa through some different avenues. So if there's anything that you may have heard of that felt like it was missing, or if you just have questions about how it all relates, I'd be happy to answer any of those as well. So thank you.
Thank you so much, Alexis. I am very impressed, and I think you set such a good example of doing data-informed work. So making sure that the data is guiding where you're providing services, but then also continuing to collect that data along the way. So thank you for that really wonderful example. All right, our last presenter in this section is Jessica with Iowa Community Hub. Help me welcome Jessica.
Hello, everyone. Get my screen shared here. Can you see it okay? Maybe. There we go.
Just load in for a second. Yep, perfect.
All right. Let's see here. Okay. I am Jessica Schellhorn, as I said. I serve as the Iowa Survivorship Navigator with in the Iowa Community Hub. Just a little background on myself. I have been in oncology for about 15 years. This has just helped me to develop a deep understanding of the unique challenges that patients and survivors face throughout their cancer journey. Over the years, the work has helped shape my passion for supporting individuals, not just clinically, but emotionally and practically as well, helping them navigate each step along the way. So currently, I serve as a survivorship navigator with the Iowa Community Hub. This is a fairly new position within about the last 6 months, thanks to the Iowa Cancer Consortium grant. I also work as the oncology nurse navigator at St. Anthony's Hospital in Carroll. In both these roles, my goal is simple: to ensure that no cancer patient has to walk their journey alone. So cancer doesn't end when treatment ends for many Iowans. That actually is when a new and often unexpected set of challenges begin. Today, there are more than 172,000 cancer survivors in Iowa. That's more than 1 in every 20 people across our state. And while survival is something to celebrate, survivorship comes with ongoing needs. Many individuals continue to manage follow-up medical care, face financial strain from treatment costs, struggle with transportation to appointments, and cope with lasting physical and emotional effects. These challenges don't disappear once treatment is complete, and they can continue on for many years or even a lifetime. So that's where the Iowa Community Hub comes in. We help connect Iowans to the support, resources, and care they need so no one has to navigate life after cancer alone. So cancer survivorship is defined in many different ways, but overall, it begins the moment of diagnosis. It is not something that starts when treatment ends. It includes not only the individuals diagnosed with cancer, but also their caregivers and families, who are often deeply impacted throughout their entire journey. Survivorship includes and involves a wide range of ongoing needs. Physically, many individuals experience long-term side effects, such as fatigue, pain, or other chronic conditions related to treatment. Emotionally, survivors may face anxiety, uncertainty, and fear of reoccurrence. There's also important social and financial dimensions, including access to support systems, insurance challenges, and ongoing financial strain. Many survivors experience gap in care coordination, where navigating follow-up appointments and services can become complex and disconnected. Together, these factors show that survivorship support is greatly needed. And so why this matters for Iowa. I started by using the data from the Iowa Cancer Plan, specifically the map that shows cancer survivors as a percentage of the county population. I know it's kind of hard to see, but I overlaid that with the locations of existing cancer centers and known supportive services across the state. In addition, I developed a comprehensive spreadsheet of the cancer programs across the state, and then created a survey targeting known survivorship programs to better understand what resources are currently being utilized. If you did not participate in the survey and interested in participating, please reach out to me. I would love to get as many as I can. When these layers were combined, a clear pattern emerged. There was significant gaps in coverage, particularly in the several rural and underserved areas where survivor need is high, but access to support services is limited. This analysis helped identify where survivorship support is not keeping pace, and that's where we need the expansion of navigation and community-based services. And that's where it would have the greatest impact. So what is the Iowa Community Hub? The Iowa Community Hub is uniquely positioned to respond to the Iowa Cancer Consortium's implementation grant opportunity with a focus initiative to strengthen cancer survivorship across the state. Through the Cancer Survivorship Navigation Initiative, we aim to improve the health and well-being of cancer survivors in Iowa. This work will be carried out throughout dedicated hub navigators within the Iowa Community Hub. We've been building on our successful partnership with Above and Beyond Cancer. This initiative will support the development and dedicated navigator role focused on helping cancer survivors connect to resources and programs that best align with their recovery, wellness, and long-term health goals. This effort directly is aligned with the Iowa Cancer Plan. Our goal is to reduce disparities in cancer care, enhance quality of life for survivors, and promote evidence-based practices and strengthen collaboration across the health systems. So what makes the hub different is that we provide the centralized navigation support for cancer survivors and their families, helping simplify what can often feel like very complex system of care and services. We also offer a statewide reach, ensuring that support is not limited by geography and is accessible to individuals in both urban and rural communities across Iowa. Most importantly, the hub focuses on practical, non-medical needs that extend beyond treatment, the everyday challenges that significantly impact quality of life during survivorship. Our key focus areas include helping individuals navigate transportation barriers, financial strain, insurance questions, employment concerns. We also support emotional and social well-being through mental health resources, mindfulness support, caregiver and peer support groups, and connection to community-based services. In addition, we promote overall wellness through healthy living and goal setting, nutrition and physical activity support, and guidance around sexual health, areas that are often overlooked but essential to survivorship and quality of life. Thriving after cancer means shifting from that survival mind shift to thriver mindset. Thriving is not just about disease-free, it's about managing the ongoing physical and emotional changes that come after treatment and living a fulfilled life. The goal is to move beyond survival and focus on the quality of life. We approach this through the 4 key pillars of survivorship. First, with monitoring, follow-up, and coordination across providers, survivorship care plans. Second, with physical health, focusing on exercise, recovery, and managing chronic conditions that may result from treatment. Third is nutrition, which supports healing, long-term health, and reducing recurrent risk. And fourth is emotional support, including mental health, peer connection, and managing anxiety or fear of recurrence. So my role as the Iowa Survivorship Navigator spans what I'm focusing on 4 key areas of work. First is with the direct client support, which includes one-on-one navigation, a needs assessment, resource referrals, and helping survivors break from overwhelming challenges into manageable steps. Second is the resource connection, where I link individuals to both local and national supports, including transportation, financial assistance, insurance guidance, and support groups. Third is community work, where I'm helping build referral pathways and educate providers on survivorship resources, identifying service gaps, and support rural health equity efforts. And fourth is statewide assessment work, where I review survivorship support across all 99 Iowa counties to understand where the services and where the service gaps exist. So together, this work can help create a clear statewide picture of survivorship support and strengthening how we help our patients. The Iowa Cancer Plan defines survivorship as a critical phase of the cancer continuum, not an endpoint. Its primary survivorship goal is to improve quality of life for cancer survivors by ensuring care that is coordinated, equitable, and accessible across Iowa. So to achieve this, this plan emphasizes strengthening care coordination across providers and systems, reducing disparities in survivorship outcome. We want to expand access to supportive services such as mental health care, financial navigation, transportation support, and other community-based resources. From navigation perspective, this aligns directly with the work of the Iowa Hub initiative, and we're helping bridge the gap between treatment and real-world support survivors need to live well after cancer. So currently, the Iowa Community Hub is partnering with Above and Beyond Cancer, and this helps facilitate communication with physicians, obtain orders for participation in evidence-based survivorship programs, We also conduct patient outreach and complete quality of life and social determinants of health assessment to better understand and address individual needs. In addition, we partner with Capital City Fruit to connect patients with fresh produce programs, supporting nutrition as a key component of survivorship care. Throughout this work, I'm also utilizing National Comprehensive Cancer Network, the American Society of Clinical Oncology, also other evidence-based guidelines to support patients across the survivorship. At its core, the hub functions as a bridge between, like I said, clinical care and community support, ensuring that survivors are not only treated, but also connecting to the resources that they need to live well beyond cancer. The hub model is built on local trusted relationships that engage individuals through a broader community network focused on whole person care. Finally, the model emphasizes accountability by tracking outcomes and demonstrating real impact. Just since November of 2025 to now, there's been 183 patients supported, and we have onboarded 17 referring partners. So looking ahead, our focus is on continuing to onboard and make navigation more seamless for survivors. We're also expanding our network of community resource partners, especially in the underserved areas where gaps in survivorship support are the greatest. In addition, we are engaging new partners who provide survivorship and wellness programs to strengthen the continuum of care. Ultimately, we're working to strengthen the hub system so it can better support partner programs and expand this access across area. This work moves forward through strong partnerships that connect survivors to care. So each of you plays a critical role in this. You can help survivors thrive by identifying barriers such as transportation, housing, food, or financial needs, and referring patients early to the hub and community resources, sharing available supports, and providing feedback on where gaps still exist. You may be the first person to recognize survivorship needs. So case managers in particular are essential partners in helping. So when you encounter a patient, please think of the Iowa Community Hub as your partner. There are 3 ways to refer patients to the Iowa Community Hub. Direct patient contact, they can call in directly for support and navigation. There is a referral form here attached that providers or care teams can complete and fax it into the hub. Or you can visit our online access, our website, or as well, you can find us on Find Help. Surviving cancer saves a life, but helping someone thrive gives them their life back. This is ultimately what this work is about, not only extending life, but improving the quality of life. Thank you everyone for your time today. I appreciate the opportunity. My contact information is listed in this slide and will be available too in the chat. And I welcome continued collaboration as we work together to strengthen survivorship care across Iowa.
Thank you so much, Jessica. Yeah, let's use those reactions to give all 3 of our speakers some love. That was amazing. And Jessica, you know, we talk so much about systems and structure change, and this is such a great example. And I also love the tie-in to the Iowa Cancer Plan. So thank you for your work and for sharing that. We are going to open it up to questions. We've got just about 5 minutes for questions. You can use the Q&A function. You can drop your question in the chat. And I think we had one for Alexis to kick us off.
Yep.
Alexis, the question is, if you find homes that need mitigation, what do you do?
Yeah, that is a great question. So it's really kind of a mix of a lot of things. We also manage what we call the Iowa Radon Helpline. That is available to anyone in the state of Iowa. It is always promoted with any of the work that we do, but it is technically managed by our state indoor radon grant program that we have in Iowa. So that is the team that answers any questions when people in Iowa call. So if they call and it's promoted to them for if you do have questions, if you do find elevated levels of radon, call the Iowa Radon helpline. And so we are able to provide them with any programs that we know exists. I know that there are a few in the state of Iowa. I know one of them, at least at one point, was around the West Des Moines area, and I believe there's a few others. So we always point them to any local resources that we do have, but we don't have any funding to support that mitigation. And so that's really a problem in schools and homes. It's kind of a problem everywhere. And so, yeah, we unfortunately don't quite have that, but we can always provide recommendations, point them to companies they can call or to any programs that we know exist.
Thank you, Alexis. I am going to, while we're waiting for another question to see if anybody has a question, I am going to ask one. So many of you mentioned that, you're collaborating with organizations outside of healthcare. So whether that's a community organization, a school, it's so important, we know, to pull in those maybe more non-traditional partners, and that can really have a bigger impact in the work. I wonder if there are any, quick lessons learned or pieces of advice or moments of wisdom that you would share with the rest of us about working with, some non-traditional partners.
I'm happy to share something there as well. I think radon work can be a bit specific because sometimes there's a lot of people that don't know about radon. And so sometimes our partnerships and our work is kind of educating people that radon is important. And so in general, working with non-traditional community leaders, and also through this program, I would say, and maybe we're lucky in this sense, I think people are very passionate about radon once they learn about it and understand what it is and understand that it is preventable. And I think that, or not that radon is preventable, but that you can fix it and lung cancer can be preventable. But I think that can kind of go across the board, right? In public health, there's a lot of actions that communities can take and that individuals can take to help prevent these chronic diseases and help prevent cancer. And I think just having conversations with partners, educating them, and really seeing what they need can just get them motivated and passionate. And then it kind of works itself out from there.
I'll agree. I'll add to that. Just in a little bit, I've reached out to local YMCAs and gyms in just small towns here in the rural area. We are very fortunate here in Iowa that a lot of smaller resources are also just as passionate, just maybe haven't been approached or thought about cancer survivors specifically or cancer patients. So I haven't had a lot of resistance. I have a lot of people who are willing to help and get some services going for those smaller resources that might not have, the YMCAs like in Des Moines and the above and beyond. So Iowa is very giving to cancer patients. So we've been pretty lucky that everybody's pretty willing to coordinate care.
I would add on to that on the prevention standpoint. We've had a lot of success reaching out to local religious organizations that are affiliated with the Latino population. And we've also worked with LULAC, the League of United Latin American Citizens of Iowa. They've helped coordinate some touch points with us, especially in Atoma, which we're looking forward to going to for the first time this year. And so I guess, yeah, echoing the same thing that both of the presenters brought up, especially Jessica, just specific smaller organizations within a community that we want to connect with if we have not had immediate success with public health departments. That has been really, really impactful.
Great, thank you. And that actually takes us up to our time. Let's give our speakers a virtual round of applause one more time. Thank you all for your presentations and for the great work that you are doing. And be sure to check out the chat because there's lots of just good discussion and love for you guys in the chat as well. So thank you. And with that, I am going to turn it over to my wonderful colleague, Rachel Schramm, to introduce our next panel.
Thank you, Kelly. All right, our next session I'm very excited about. We are going to hear from a couple health agencies from Polk, Lynn, and Woodbury counties who have really, taken the cancer data about our state and their community in stride and are using that to make an impact locally to bring people together. So I would first like to welcome Julianne from Polk County Health Department. Welcome, Julianne.
Thank you so much. Hi, everyone. Good morning. I'm going to share my screen here. Are we seeing that okay?
It's just loading for me yet. Yep, I see your presentation,
Okay.
and I don't know if you want to go full screen mode.
I think I will. I only have a few slides, just to kind of guide me. And
Perfect.
so I'm Julianne Van Loo. Hi, everyone. I've been the director here at Polk County Health Department for just about the last year and a half. And we have some of our other amazing staff on here. I saw Kim McMains, who is going to help actively run our coalition that I'll talk about, and some other staff. So for us, it's true. We have kind of taken this new data and this kind of public attention on cancer to heart and are really trying to, I think, figure out what's the exact right role for a health department and how do we help not just us find our role, but our other partners find their roles in healthcare. But as you mentioned earlier, as was mentioned, beyond healthcare as well. So we are at the very beginning stages. We had a really great 99 counties presentation in January from our folks at the Cancer Registry, who really helped lay the foundation and really spur some energy and momentum in Polk County. And so we really launched from there. And at that event, asked folks to follow a QR code, let us know if they're interested, and we had good, solid response, as well as just general good response from the media and kind of community partners from that. And so we knew the interest was there. And the way we're kind of thinking about it for other health departments on the call, or for folks who've ever worked with the health department and have taken on what we call a CHIP, a Community Health Improvement Plan. We are considering this basically using the same kind of structure and approach and process as we do for our CHIP, because this is what we're trained in. Polk County, or the health department, shouldn't necessarily be a big implementer among all of these strategies, but what we can do is wrangle the data, facilitate conversations, bring broad stakeholders together, and do the hard work of helping us prioritize what are we going to work on, because there is an endless amount we could do in the cancer-related spectrum. So our hope is to put together a Polk County Cancer Coalition that can help us do that work over the long term, doing that prioritization as well as creating and implementing that plan. Some of the languages here from the invite that we literally just sent out in the last few days, because we launch here in May. I'll share more about that in a minute. But what we're trying to talk to folks about in our language and in our messaging is just helping them realize kind of the sheer number and how prevalent this is. And I think everybody knows someone who has had or has cancer. And so matching that, their own experience with that high number is important. But then we're pointing as much as we can fairly early in this and making sure that prevention is a primary angle that we're using here. We'll include, cancer-directed therapies and screening, which are crucial. But we want to make sure, I think sometimes what's left out of the cancer conversations is that primary screening for things like tobacco use, for the radon, those sorts of things. We're really going cross-sector here, so we have a huge invitation list, of course, public health and healthcare, but a lot of community-based organizations that maybe necessarily aren't working on cancer, but they're touching food or housing or transportation, because they're working with folks in Polk County and they understand the salience of this issue. So we've had, I think, good luck getting folks interested. We'll see in our event how many folks show, but we're planning for a large event space, I'll tell you, for Polk County. But really, we're trying to align efforts, share data, identify gaps, and then take coordinated action. Our goal, very straightforward: fewer cancer cases, better outcomes, and healthier communities. So we'll use that as our rallying cry to help folks know we want fewer cancer cases, we want healthier communities. And then the way we're going to operationalize this is by moving into the structure that's set out for us by the Iowa Cancer Plan. So I am thrilled. I've not seen a plan quite this comprehensive and strong in other states where I've done public health work. And so I just feel incredibly lucky that we have something to leap off from. We're not starting from scratch in the least. And when you're running a CHIP, like a genuine community health improvement plan, you really are starting from bare bones with just what are people interested in. But here you have a plate that's very very clearly outlined into different sections around not just what can you do, but what are the evidence-based practices showing us, and how are those tied back to Iowa cancer outcomes. So what we see as our job in Polk County is to distill that even further. Let's use now not just statewide data, let's use Polk County specific data, and let's figure out which of the strategies they've laid out in their plans makes sense most for us. So we'll be working in these 3 work groups. The Polk County Health Department will provide what we're calling the backbone support for the Polk County Cancer Coalition. We will have our staff in each of our work groups. We'll kind of lead the monitoring and evaluation plan that we need to build, and really kind of herd the cats, keep folks moving, and be kind of the larger face of this, hopefully in what feels to folks like an unbiased way, as a convener, as an agency that's really just wanting to support everyone, and understands that we need the whole spectrum here to move this work forward. We've also done a lot of work to make sure that we're consistently looking at the data throughout the process. So not just as we're jumping off, okay, yes, we have higher lung cancer rates in Polk than in some areas. Do we probably need to focus on radon? Yes, probably. But as we move into more granular strategies, looking at more granular data and seeing what else we can do within those specific strategies with peripheral data, with demographic data, and making sure that we're really targeting and tailoring our strategies for the right populations who need them. So excited that DMU has offered to step up and consistently help us throughout this planning process by responding to our data needs and requests, bringing that data as granular as possible to our work groups, helping us tease it out and think through it. And I think that will be something really that's just a cornerstone of our work, because we want to make sure we're doing this again in a way that's going to maximize the use of our resources. And then, as I mentioned, we're putting together 3 work groups. So the Iowa Cancer Plan has a couple more chapters. We're embedding kind of equity throughout these 3 work groups, but we've decided that it makes sense for us to have that primary prevention work group, that screening and detection work group, and then a work group that includes both the cancer-directed therapies and kind of the post-cancer care along the way. And so combining those 2 groups together into that 3rd bucket for us. Here, I should show these again: prevention and risk reduction, early detection and screening, cancer care, and beyond. And we feel we need to do this. We're not going to get into those groups necessarily, although maybe a bit, in our very first meeting, because we want folks to see everyone across the full cancer spectrum. But then we want to make sure that folks are spending their time on the area where they have leverage and interest and can move and work. So getting into those work groups will be crucial. And what we'll really do, I'll talk about the timeline in a minute, but we'll spend a good amount of time going again through the cancer plan strategies that are specific to that work group, looking at our data, and then doing a little what we call sometimes ecological assessments. So in this work group sphere, if it's prevention, who are the partners, where are the gaps, the assets, and the needs, and making sure as we're considering how we prioritize those strategies, we're taking into account the data, of course, but also the gaps and needs that our community partners and individuals and residents identify themselves. And then we'll use our public health tools to go through a prioritization process, which is tough because you cannot prioritize everything. But we hope to do it in a way where we can bring everyone along, and that maybe if the strategy that their particular interest was in isn't a priority strategy, that they can find themselves somewhere, some way in those other strategies. And then broadly speaking, the work that we do can support and lift up a number of strategies, even if they aren't our direct priorities, because we really don't want to lose people in this. We want folks to feel engaged throughout. And then we're hoping to put together a 3-year action plan. We'll see kind of how that looks, but we want to make sure that we're measuring both the process and the progress of working together as a community on these issues, and how we're doing in creating shared solutions where people are accountable, as well as those outcomes, hopefully, that we can see in some of those spaces with particular strategies and projects. So we actually launch here in a few weeks on May 20th. The team has been really hard at work, excited about this. We'll then convene our work groups the following month, and we'll really spend about 6 months going through the process of looking at our data against the cancer plan, finding our priorities against those needs and gaps, and creating a plan that we hope will have enough foundation and infrastructure that it doesn't become just this thing that we sometimes do when our week doesn't have have a full 40, right? So this for us, we want to make sure that it becomes a priority. So we'll be carving out staff time and really hoping to make sure that the priorities we choose are salient enough that many other people want to dedicate staff time as well. So these timelines, as we learned with our chip, they are messy. It can be longer sometimes, but I can't emphasize enough how great of a jumping off point we have in this plan, that you don't have to do this from scratch. You can really take what they've given you and come up with, I think, will be a great set of strategies. So hopefully my other colleagues coming after me have a little more to share about implementation, but we're just in this getting ready phase, and I can't thank enough for grant opportunities I'm seeing come out for implementation dollars. It is very, very often that we see funding come out for a particular project or a program, but what we need right now are dollars to create these bonds, these coalitions, these partnerships. So I think we're moving in the right direction collectively as we're doing that and focusing now on this cross-sector collaboration. That's it for me.
Awesome. Thank you, Julianne. I have a post-it note. This is getting me so excited.
Yeah.
Oh, awesome. Well, thank you, Julianne. We'll save questions until the end, but feel free to either pop them in the chat or the Q&A. But our next presenter is going to be Cindy from Linn County Public Health. Hello, Cindy.
Hello, I'm hoping I can share slides here. Sorry, guys.
No, that's okay.
All right.
They're just loading up for me.
Can you see a slide that's not in presenter view?
Yes, I can. You're good.
Okay. All right, thank you very much. And thank you to my colleague in Polk County for sharing all of their amazing work. You guys are a tough act to follow. But I do hope that we can all collaborate after this meeting and make sure that we can learn and build upon everything that we're doing across the state, and offer support to one another as we do this work. So thank you for sharing your story. So I'm here to talk a little bit about what was addressed during the Polk County presentation by Julianne regarding the community health assessment and the community health improvement plan. Those things are the basis for our work in the Linn County area. And we use that kind of as our guiding document, along with things such as the Iowa Cancer Plan, to inform our work. So our brand for our community health assessment and community health improvement plan process is called Together Healthy Linn, within the umbrella of Linn County Public Health. It sounds a little bit more inviting and exciting, I like to think, than saying a community health assessment and a community health improvement plan process, or the CHA chip, because people wonder, are there chips involved? Food, not necessarily. So we try to have a little brand recognition as we bring our partners together. So all of the work that's done within the Linn County Public Health, the CHA chip space for Together Healthy Linn, is centered on the MAP process, or MAPP, 2 Ps at the end. It's mobilizing for action through planning and partnerships. And Linn County Public Health performs or helps facilitate this community health assessment process, and helps also formulate and facilitate the community health improvement plan with the partnership of health and community partners and community members. So this is not something that is done in a vacuum. It requires a lot of planning, partnerships, relationships, and this is also done by our awesome staff within a 3-year cycle to align with health system assessment requirements, because we like to do our work in a fashion that allows us to go further faster together. And in doing that on the same cycle and alignment with our health system partners, this greatly aids in our collective efforts. So the map process is used. You can find that online if you're curious about looking into what that entails. The public health partners probably know what we're talking about here. So in this slide, this is a very brief summary of the focus areas or the priority areas of the 2025 through 2027 CHIP efforts that we have underway. Just so we are clear, the policy area is kind of overarching for all three of the areas: healthcare access, supporting mental health, and chronic illness prevention and management. The 99 counties presentation was referenced, and that has been a fantastic tool or means of engaging partners to get attention to this topic and to spur work going on within the community, because we had some community partners that took that information and ran with it in groups that they meet with regularly to facilitate action on a local level. Within that community health improvement plan structure, the chronic illness prevention and management area is really kind of where the work takes place as far as facilitating and standing up and supporting efforts that have to do with cancer prevention and control in the Linn County area. We've kind of laid out our goal, our objective, the focus areas, and we're looking really strongly at clinical cancer screenings, where are they available and to whom, and coordination of efforts across CHIP work groups, because it isn't just one community health improvement plan or Together Healthy Linn work group that is responsible for all of this. It really does take a village, as they say. So cancer prevention and control work does primarily land under this work group, but it spans beyond this group. And the Iowa Cancer Plan was a driving force, along with our community health improvement plan and all of the wonderful data that our epidemiologists are able to supply to help us find our direction with this work. So the next slide is going to cover a little bit deeper about current action items and the action plan that's in place right now. The graph or the table on the right is a little bit on the busy side, so I do apologize about that, but I wanted to tuck information in here about what is currently going on within the work group and their action plan. So we have several things that are going on, and they kind of cross the implementation areas of our community health improvement plan. Sorry. So big picture current action items are on the left-hand side. We are working very hard to stand up work regarding health insurance and healthcare access through things like a Health Insurance 101 education session, and ensuring that Medicare, Medicaid, the marketplace, employer-covered plans, and more are covered in this work, because healthcare access and health insurance is complicated. And we want to make sure that people have the tools that they need in order to be able to access healthcare. And then beyond that, we have work going on in the primary prevention space with incredible partners at agencies that work on substance use, education, prevention, and advocacy. And so we have a number of partners working on the connection between alcohol and cancer. We are looking at joint screening opportunities and protocols between our health systems in this area. We are a very resource-rich area of the state, and we want to make sure that people have access to what they need when they need it. There are a lot of fantastic partners that do work in the space of food as medicine and screening for hunger as a vital sign. And we need to make sure that their work is featured and also able to be incorporated into all of the points in which the public interfaces. We heard about the Iowa Community Hub and screening for social determinants of health. These things matter very much to people's survival and thriving after cancer treatment and during cancer treatment. And so much of this is interrelated. Partners work very hard to make sure people are connected, and the work is stable and ongoing. We have work going on in the diabetes prevention and management area too. I'm going to share an event that's coming up just so we can plug that. Not necessarily cancer related, but we have some incredible partners that support that work as well, that participate in these groups. And so collaboration is key. We always encourage partners to bring people to the table, invite your friends. This is not a one-size-fits-all thing. We want to make sure people can engage and bring their work to this space and drive cancer prevention and control even further at the local level. So public health is a backbone organization or an integrator organization, and we hope to support community partners as they perform critical work in our community and get them the resources that they need to go further faster together. I took some screenshots of some events that are examples of things that our community partners have done together in the last year, basically. So one of the things that we've learned from a graduate nursing student who has lent a lot of time to our community outside of her typical practice is that there are a lot of programs available, a lot of rich resources in the area, but a lack of awareness and access to those things. And so we do hope that with our partners, statewide partnerships, local partnerships, and all, that we can make sure that these things are front and center and easy to access. They are where people need them and when they need them, and that we have supports and systems in place to help populations in need. We've had health insurance coverage events. We've helped people with some really incredibly complicated access to healthcare issues, removing barriers to screenings for breast cancer, cervical cancer, hopefully other cancers in the future can be a focus area as well for education. We have found that offering free continuing education is key to getting people involved in these events and learning about what's available. And so we hope that we can continue that as well. These events are in the past, but here's a future event. I'll leave this up for a moment. We can send it out later. This is a hybrid offering. I guess there will be an in-person offering, but also a virtual offering for this. And the CEUs are free. So I'm just going to throw that out there. We would love it if people can join. This is another program that is linked through Iowa's Community Hub and Iowa Health and Human Services. And so another shining example of resources and supports that are available in our area, and we'd love to have people engage. Lastly, shameless plug. So for anybody that's in our area, this afternoon, we have a meeting of the Chronic Illness Prevention and Management Group that I referenced, which is kind of the space in which all of this work is spawning locally, and our amazing partners get together. We do have a meeting today. We are talking about food as medicine, the data around that program, and our local community action program food reservoir staff are going to be there to talk about this. And if you would like to join us, we do have a virtual meeting. Email me, I'll forward that to you, or you can come in person. The more the merrier. If you're in this area, we welcome you. We need you. Without you, we can't make this work happen. So I'll plug this as much as possible, but that is all I have for sharing for right now. But please reach out if there's anything we can do to help with examples, collaborations, anything we can do to make partnerships happen to support our work, but largely our work is kind of centered in our community health improvement plan and Together Healthy Lynn and the work groups that are in place for now. So thank you.
Thank you, Cindy. And would you be willing to put your email in the chat if anybody wants to connect with you?
Absolutely. I did not have a conclusion slide with that, did I? Sorry about that.
No, it's okay. Everybody knows you, right? No. All right. Well, thank you so much for your presentation, Cindy. It's exciting to hear what's happening in Loon County. So, last but not least, I want to introduce our dynamic duo from Unity Point St. Luke's Junine Island Cancer Center, Krista and Christy. I'm going to get your slide shared, okay?
Okay.
All right.
Thank you. You want to start?
Yeah, my name is Krista McCullough, and I am the director here at the June Nyland Cancer Center. I've been here about 30 years, since 1995. So very excited to see all our work through the years and come together in this coalition, because a lot of what we've done in the past, we can now use our resources in our community to move our work forward.
And I'm Christy Finnegan. I've been at the Unity Point Health St. Luke's Junine Island Cancer Center for 7 years. Yesterday was actually my anniversary. I was in a role of both joint marketing and fund development. My role is changing a little bit. We'll talk about this here, how our organization has changed. So next slide, Rachel, please. I'm going to start with our previous two presenters talked about their CHA chip, and we are actually the co-chairs of one of the work groups developed out of the CHA chip. We do up in Northwest Iowa in Woodbury County, we do it a little bit uniquely. Maybe others do it, but in Woodbury County, it's a collaborative community health needs assessment, and it is by the groups listed there. Our Siouxland District Health Department, Unity Point Health St. Luke's, Mercy One Siouxland Medical Center, and they brought on board one of their partners, Dunes Surgical Center. So they go through the process all together and developed the 2025 to 2027 Community Health Improvement Plan. And cancer was one of the identified priorities. And that is when they stepped forward and said, Christy and Krista, would you please chair the cancer work group? And since this planning, I should note that there have been some changes in our community. In May of last year, in 2025, it was announced that there was a signed letter of intent between Unity Point Health St. Luke's and the Mercy One Siouxland Medical Center. And in September of last fall, St. Luke's acquired the Mercy One Siouxland. And so now the two hospitals in our community are one. The Junine Island Cancer Center was a joint venture of both hospitals. And so with the acquisition and one hospital, the joint venture went away. And the Junine Island Cancer Center is now a hospital department of St. Luke's. So in amongst all of the information we're sharing, there was a lot of community change going and organizational change as well. And so I think that added some components to our plans. Rachel, next slide, please.
All right, and of the 5 strategies that the CHIP plan focused on, it was mental health, cancer prevention, substance misuse, physical health, and sexual health. And so this slide is the one that is dedicated to the community need number 2. How do we address the rising cancer incidence rates in our community? So one thing that Christy and I were very excited about is when we received the packet on the community plan, that these other priorities and these other groups that would be working on these issues are going to help our work as well. So we will talk more about our objectives and strategies, but we just wanted to provide this slide with what our actual tasks were set out to us. Next slide. So when we were asked to co-chair this coalition, Christy really started in with a lot of the work. She reached out to the members from the steering committee, sent the invitations, and really got the ball rolling to hold the meetings here at the Cancer Center. We started out our meetings, for those of you that are starting your groups, we started meeting every month. And we talked about that might be obsessive, kind of too frequent, but we started the momentum and we didn't want to lose what we were started with. We also made our meetings in person and recently just gave the option for virtual attendance. We were very excited to see the group that we had in front of us because we had been so focused just on cancer. And when you had all these different community centers coming into the room, we were able to build on their strengths and the things that they were maybe already doing and things that we could put into our plan. So next slide.
So the Siouxland Community Cancer Coalition, the goal was to decrease, and this came right out of the community health care plan, reduce the incidence and mortality rates of colon, cervical, and breast. And we decided our coalition's objective then would be increase the screening rates for those three cancers 3% over our 3-year plan. When the steering committee met, they had actually determined that and had the measurements. Once the coalition formed, we decided we would stick with that objective, but we changed how we were going to measure it so that within our coalition, we could find the measurements more accessible. So we are actually using for our county, the behavioral risk surveillance system measurements for Woodbury County is how we are measuring over the 3-year plan. We took those and developed 2 strategies. And again, the previous presenter talked about prioritization. We had a lot of ideas in our first few meetings of all the things that we could do, but we narrowed it to 2 strategies and then just a couple of initiatives in each strategy to prioritize where we were going to focus our efforts first. The first strategy is really tailored more towards think broad perspective, more of your public. The second strategy was targeted more for how we could partner with businesses and do more of the employer focus. And then we stuck a lot of things into the parking lot. Next slide, we want to just talk a little bit about the first. We also gravitated towards strategy number 1 is going to be where we rolled out some things. Developing a recommended cancer screenings and way to reduce your risk. And then doing some targeted PR around different avenues, as well as talking about sharing the data. It might have even been said in our coalition, we need to scare people into action. And that starts with some of the data and the actual statistics for our region. I want to, and then we also talked about screening and awareness, PSA campaign, pushing out more towards that, and then a public type of an event. And those 2 are in our parking lot yet. That's our coalition's next focus. I want to talk a little bit about, and these actually happened in the order. So flip to the next slide, the recommended cancer screenings. This is something that had a lot of discussion in our group. It was one of the first initiatives we went as a group that collaborated on this. And you would not think this would be very challenging because many organizations probably have it. That was the case with our group. But when you are working in a group of collaborative, every group used a different recommended guidelines. So depending on the group, what were those actual recommendations might be slightly different. For example, the different guidelines, how could determine is it an annual mammogram or every other year? And there was a lot of discussion on all these different groups. No wonder why patients and the public are confused about when they're supposed to get their screenings then. So step number 1 was we collected all of the different, whatever group in our coalition, what they used, and we came to consensus for what the coalition was going to promote. This is the guidelines we're going to use going forward, the NCCN guidelines. And they had to take it back to their groups and to say, for the coalition work, is everybody in agreement of that? We also then were going to push this out, and there was dialogue around, do people know who the Cancer Coalition is, the Siouxland Community Cancer Coalition? And we decided to go forward with the members of the steering committee using their logos on it versus the Cancer Coalition for the credibility factor. Right about the time that we were rolling this out, there were actually listening sessions in our community from the Harkin Institute and the environmental around that. And there was a lot of who do you listen to and that. So we decided it was better to put the logos of our organizations on there for that fact. So I laugh when we put this in the slide, like this should be so simple, but it took probably 4 months of work to just get this done. And so I think be okay that sometimes the simplest things, because it's the first time that it's multiple groups working together, it takes time to build that momentum and to go forward. Next slide, please, Rachel. We are then, one of the things that we wanted to work on was maximizing relationships with our local media and the PR.
Right. And so we did, with the screening recommendations, we made sure that those recommendations went out to providers from all of the members, all of their facilities, so that they would all be on the same page with what their patients were seeing. We promoted the home testing options for like the colorectal, radon. We have promoted that. One of the things that we were both surprised with when we got the group together was some of the myths out there about cancer. Like they said, well, we've heard sometimes if you get a mammo, that can increase your risk of cancer. Or is the sunscreen or those materials in the sunscreen actually cause the cancer? So we're starting to work on those. We've done some advertisements or some talking sessions with local providers that try to put some of those myths to rest. So, and then also one of our members on our committee is actually one of our patients, and she was able to do some testimonials for us. But we are going to work in all these areas and continue to promote and try to really give the education to the people of Siouxland so they understand the risks.
So those are the months that we focused on so far. And within every month, we would do 4 stories at least. What are the recommended guidelines? And the provider would talk about that. Was there a home testing option? Some myth-buster pieces, and then a patient success story. And so those are the ones that we focused on now. We'll add prostate and other cancers and going forward. The other part of our coalition is every group already does so many things for cancer prevention. And one of the consensus aspects of our group was helping to promote and to maximize everyone's efforts. So here's just some examples of what some of our members in our cancer coalition did, and then how we share it out within all of our promotional aspects. And when the coalition did those story ideas, we would ask everybody to also share it out onto their social media platforms. So just trying to maximize whatever everybody's already doing. The other piece, and you've heard this, and I joked about it a little bit. Next slide, Rachel, was sharing the data. That was important to our coalition. We maximized our 99 counties project. I saw Dr. Mary Charlton in there. Krista and I had actually met with Mary and her team just on early in 25 with our cancer centers, and they said this was coming down the pike. So we really put a lot of emphasis and as a coalition reached out to the public, our city officials, our elected officials worked through our chamber and really pushed attendance at this. Our media was really supportive and helped get multiple stories leading up to it and after the fact. And then we put a lot of the data that we do and shares onto a cancer coalition site that our district health department is hosting for us. Strategy number 2 is targeted towards our employers. We're earlier on in this part. Part of that is, again, we wanted to start with our 99 counties project. We are looking for ways that we can partner with our SHRM representatives, because what is important to them, and if they see our cancer data, what is important to them to implement out into their workforces. And so we're early on in that, but I hope we make some progress over the next few months with that. And then based upon the feedback from those SHRM leaders, we'll determine, do we partner with some of them and do some specific things, or maybe we target a couple that already some of our health organizations work with and to do some specific things. So more to come. Next slide, more to come. I feel like we've been underway for a year, but we have more strategies and more goals. And we laughed a little bit because I said we did have some things that we, over the year, despite all the acquisition and transitions and changes that we went through, and sometimes you just had to put it in a parking lot and say, it doesn't make sense to do this, and going forward, we continue to have work, and we will add people to our group as the opportunity presents itself. And the last slide, we have our contact information, and we'll drop it in the chat, as well as our Siouxland District Health representative that has a big historical aspect of our CHOT chip process. Thank you.
Awesome. Let's give them a round of applause. All right, and I'm just kind of looking through the chat to see if we have any questions or the Q&A. Carrie Shannon from Johnson County had said, these are great, referring to your materials just about cancer screening. Would you ever be willing to share with attribution, of course?
She's putting the slides in there.
Oh, just their contact information. Oh, the screening guidelines. Yes.
Yeah.
Yes.
Okay, awesome.
And maybe that will help someone else, because that held us up we thought we would get that done in one meeting. And we were like, oh no, this is taking,
Yeah.
It took almost 4 or 5 meetings, and then to take it to print and finally get it out. So
yeah, I was gonna say, taking one for the team, that seems like it might save a lot of people time.
The work already done.
For sure. Any other questions from folks?
There was a couple other questions in the chat, and there's one in the Q&A box.
Okay.
So there was a question for Cindy. How do we get more information on the food as medicine data? Sure.
About that. I did reply in the chat just now. I'm happy to get people connected to our local community action partners, or I could get information from them that might be more applicable statewide. I am not a subject matter expert in food as medicine, but we have amazing people that we reach out to and refer to in that space. So happy to make a connection.
Awesome. And then Courtney had asked is there something you needed to move your initiatives to the next level? What would that be? And thank you to the presenters for such impactful work.
We have talked in our coalition that legislation is our next level. I mean, we can do this work, and maybe bringing all the coalitions together and work together on the Iowa Cancer Plan. But we really feel that we need to get the support of our organizations and our providers and go to the legislation level, because you can talk all about this, and until a person or someone takes it seriously, or it affects them in a way that makes them change their behaviors or their habits, it's not going to change. And so we have talked a lot about that, of how we take that to the next level.
I think the other piece is your call to action through it all. What's the appropriate call to action? And depending on your coalition and the members of that, does that support that call to action?
Great. Thank you. All right, and we're just a little bit over time, but thank you all to our presenters. I really appreciate you, and so exciting to see the work that's happening, and even just the behind the scenes process stuff, I think is really, really exciting. So, okay, we are gonna do just about a 15-minute break. So if you want to come back just 2 minutes after noon, we'll get started with our next presentations. Thank you guys so much.
Thank you.
Welcome back, everyone. I hope you had a nice little break. We're going to move into our final panel presentation. Today's presenters for this next panel were funded through the Healthy Hometowns Iowa's Rural Health Transformation Plan, an initiative with the Iowa Department of Health and Human Services. And we're excited to learn more about the projects that they have planned. Please help me welcome the Cancer and Healthy Hometowns Project panel.
Good afternoon. Thank you so much for having us. And thank you for the meeting so far today. I've learned so much. The presentations have been very helpful. So I appreciate all of you sharing what you're doing in your communities and how we can hopefully do something similar in our communities as well. So I'll do a quick introduction. My name is Lindsay Spoelstra. I'm the director of Marion County Public Health Department in Marion County, southeastern Iowa. And we have been awarded the Healthy Hometowns Combat Cancer Prevention and Screening Program. So that's what we will be discussing with you today. And I'll let Stacy introduce herself as well.
I'm Stacy Haas. I am the program manager for the combat cancer here at Marion County Public Health. And excited to kind of get started with this across the state. I've been here with Public Health for a little over 10 years doing a variety of program management.
So the Combat Cancer Project is a statewide rural Iowa focus. And what we have planned to do is to drive this initiative through local public health departments. We've talked this morning a couple of different times about community health needs assessments. And I believe that through those assessments, we've really gotten to know our communities. And so the idea of public health serving their communities as we try to prevent cancer and screen early for cancer is the perfect combination. So we're excited that we've got roughly 60 public health departments who have signed on to help us with this project. We are just in the beginning stages, so we're about a month into our contract, and this first project period runs through the end of October. So we do have a lot to do. We're excited to continue to get started. We have definitely started, and looking forward to that implementation. So I'm going to turn it over to Stacy, and she'll discuss the different areas of focus.
Yeah. Yeah, so I'm just gonna kind of highlight a couple of the areas that we're focusing on through this initiative. So we're focusing on screening and prevention. And so the three main areas that we're focusing on are lung, colorectal, and skin cancer. And kind of through those initiatives through lung cancer, we're focusing on radon. And so we know that radon, outside of smoking, is one of the top risks for Iowa. We have high numbers across the state for radon concerns. And so as we've kind of done our assessment and looked at the variety of counties across the state and the differences that they all lay out, one thing's in common: radon's present in all of the counties. And so our goal is to try to tackle screening across the state. And so what we'll be looking at for this first phase project, and the project is going to be screening over 30,000 homes for radon, which seems like a big number, but in perspective, we know many homes across the state have not been screened. And so our goal is to first start with identifying where those concerns lay. But we also know as we assess for radon across the state, there's many barriers to that. So one is the financial means to be able to mitigate an individual's home. And the second is, if people look to get mitigation, is there's not a lot of people across the state that provide the service. And so to tackle those obstacles, we will be providing financial assistance to help mitigate homes across the state. And so they will have to do through our program, and then we will help them, those that are identified to be at an elevated risk. We will help walk them through that process. And why we say we mean the public health departments across the state. So this is public health in action, us being able to know our constituents across the state, and also knowing that every county is a little bit different in how we do that outreach. So every county has, different pockets of populations that maybe needs outreach completed in a different format. And so we're working to accommodate all of that, so we make sure that everybody has access to the education and information. mitigation services, we know we need to train people to be mitigators. And so we're going to be looking to increase the workforce for mitigation specialists and also measurement specialists. But we're putting a focus on the mitigation side as our focus is on individuals' homes. We know businesses and organizations need those measurement specialists, but we want to make sure that the homes that we mitigate or test, if families want to look at mitigation, they have accessibility to that. Then on the colorectal side, we're looking at testing individuals that have no insurance. And so we know individuals that are uninsured are less likely to be screened on an ongoing basis for health concerns. And so to increase screening and prevention measures, we're going to be looking and working with our public health departments to identify individuals across the state that do not have insurance and that potentially would benefit from having a colorectal screen. But we also know that just because you screen somebody, okay, we don't want to leave an individual with a, hey, we've screened you, now you're positive. What do I do with it? And so we'll be providing medical coverage for we're providing medical coverage for them to be able to go to the doctor so that they can be seen. We're providing that financial assistance to be able to be seen at the medical doctor. And then we're also working collectively through this initiative. We know that there's some gaps there. And so we're working to fill some of those across the state with, colonoscopies and those kinds of things. So just because we know that the barriers there for them getting to the doctor, we're also looking for those additional gaps that are present. And then on the skin cancer side, we are working sorry, I apologize, I should have held that. We are working to, on the skin cancer side, provide doctors with the accessibility and education to be able to screen individuals that come in. So our goal through skin cancer, part of this is early detection. So we know individuals that are screened and identified to potentially have a concern early on, interventions a little bit easier and for that access for care. And so our goal is to put dermatoscopes in the hands of our primary care providers across the state in the amount of about 1,475 dermatoscopes. So dermatoscopes are the tool used by medical professionals to be able to look at skin spots on individuals' skin to be able to identify whether or not there's a potential concern. And we know every provider is not the same, and so we're looking at not being a one-size-fits-all kind of for that skin cancer. So giving providers the option to do an AI-based dermatoscope and then also a traditional just handheld device. We want to make sure that we're meeting the provider's needs that they have and that they're able to meet individuals' needs as they come in to be screened. In addition to those, lung cancer, colorectal cancer, and skin cancer, we're also going to be doing some education. So many of you gave great presentations with education and materials that you're presenting out and doing those work throughout the community. We'll be doing some of those similar initiatives and providing education. And our goal is to touch those individuals in a rural setting. So making sure the education is tailored to the rural setting and that we're identifying populations that needs that education that maybe, it's not doing proper, skincare with thinking about, wearing proper skin protection with, what they wear with the hat, sunglasses, that they're wearing sunscreen, those kinds of things. And so also we know that there's a lot of misconception around radon. So we want to make sure that we're giving that out to individuals so that they know what radon is, at where it comes from. We get a lot of, questions so far as people have learned about this. They're questioning, what is radon? How did it get into my home? And so we can kind of start to break down some of those myths and concerns. In addition to that, we also know accessibility to care can be a barrier for many individuals in rural Iowa. So our goal through this initiative is to increase the accessibility to medical providers. And so by doing so, we're going to be placing tablets across the state into each community or each county within our, our coverage area. So this initiative, we're looking at all counties in the state of Iowa that are classified by HRSA standards as rural. And so there's 3 counties within the state that are not falling in that, but the other 96 will be looking to place tablets into locations within the county that we're not necessarily looking at, the most populated areas. We're wanting to look at areas where maybe they don't have a medical clinic, where individuals are going to have accessibility that's going to take a little bit more to be able to access a medical provider, breaking down those barriers with transportation, stigma that is going into a clinic. And so providing tablets out into libraries and pharmacies across the state to be able to increase that accessibility. And so, kind of talk a little bit there about that campaign for messaging, but we are going to be putting an emphasis on messaging across the state as well, and making sure that we're putting out that information. So everybody is across the state putting out the same information. We know it takes a lot of touches to be able to, for individuals to be able to interpret what that message is. And so our goal is just to increase education, accessibility, and awareness for these concerns across the state, to be able to positively impact the cancer rates. So I'm going to hand it back to Lindsay to kind of talk about what work we've done so far.
Yes, as I mentioned earlier, we are still in the beginning stages, but we have started and we're moving along really quickly. So what we've started putting together is a media campaign. This will include social media, flyers, handouts. Basically, we're putting together a toolkit for all of our public health partners to be able to share information about where people can get supplies, where they can get testing, where they can get more information, all in one place so that they can be easily shared. And we're also looking into translation for those that need to be translated into another language. We are developing partnerships with local public health departments across the state, as well as other invested organizations, professionals, and subject matter experts. So we're working closely with Iowa HHS. We also have worked with the Iowa Cancer Consortium. They are putting us in contact with some of the people that they know that can help us with this project as well. The American Lung Association was gracious enough to give us a few hours of their time a couple weeks ago to give some insight too. So we're learning like crazy as we go. And we're grateful for those people who are coming alongside us to make sure that this project is done well and it's done right. So that is all the information we have at this point. And we are open to questions. If you have questions, we'll answer them to the best of our ability. If you have advice or people that we need to talk to, or anything else you can think of, this is our contact information. Please send it our way. So we are just drinking it all in as we go, and moving forward with the information being provided to us. So thank you for your time today, and we look forward to hearing from you.
Hi, Megan. Is it time for me to share my screen?
It is time.
Okay, perfect. All right. Can you see that okay?
Yep, we can.
Okay, thank you. Well, for those of you who don't know me, my name is Vicki Meany, and I work at the College of Public Health at the University of Iowa. And I'm super excited to be here. Listening to everything that's happening in our state is very inspirational. So I'm glad that I was able to be a part of this meeting. I'm also happy to see familiar names and faces as I scroll through the participant list. So again, just really great to be here. I'm going to be sharing some information with you about a new project that is also funded through the Rural Health Transformation Grant, and it's titled Combat Cancer Technical Assistance. This project is really about helping provide education and technical assistance throughout the state, and specifically to hubs and spokes. And I'm going to talk a little bit more about that in some detail, but I do want to let you know that we did just sign our contract with Iowa Health and Human Services on April 8th. So what I'm going to be sharing with you are a high-level overview and also sort of what's expected of us as the technical assistance provider. You may have questions, and if they get too much into the details, I won't be able to answer those questions because we're still actively sort of planning this out. This is a collaborative project, though, at the University of Iowa. It's led by Dr. Mark Burkhart at the Holden Cancer Center and myself at the College of Public Health. And along with us, there will be several subject matter experts across the university, Iowa Healthcare, and others as we continue into this project. Just to give you an idea of a high-level overview, our project is structured as a two-phase technical assistance model, and it's designed to strengthen cancer prevention, screening, and care coordination, along with financing across rural Iowa. And I'm going to provide a little bit more detail about that in a minute, but phase one, essentially, if you look at the big picture, it focuses on statewide readiness and capacity building. And it's really to ensure that all interested rural organizations have access to the foundational tools and to the knowledge. And then phase two, when we get into that, that builds on that foundation, and it provides intensive, what we call customized technical assistance to those selected cancer health hubs and their spokes. So as you probably all know, Iowa HHS has let out RFPs for hub and spoke systems. And the intent is that hospitals will come together to form these unique partnerships. And over time, the anticipation is that the model will provide better access to care and provide that care closer to home for cancer patients and their families. All of the provided activities are, of course, aligned with Iowa HHS and the CMS requirements. So phase one is intentionally broad and inclusive. All the technical assistance in this phase is sort of general and non-individualized, meaning that it's open, it's public facing, it's not tailored to any specific organization. Eligible rural organizations essentially means that if your organization is involved with or interested in cancer care, then you're welcome to attend. The intent of phase one is really, again, to strengthen organizational capacity, to strengthen partnership readiness and implementation and funding capacity across the rural cancer system. So that the purpose then becomes that as we move into phase two as a state, that entire system of care is better prepared to be successful. And like I said, anyone can participate in phase one. It's not tied to any specific funding opportunity. That is a question that we get asked sometimes. So more specifically about the audience in phase one. Again, I've kind of mentioned this a couple times, but it's open to all. It's going to be tailored for a diverse set of rural health and community organizations. And you can see those organizations on the screen, but essentially everyone is welcome. Our technical assistance will be delivered in multiple accessible formats, and that will include in-person opportunities, virtual opportunities, sessions that are recorded, if that is a possibility, and then also written tools and resources. And the idea is to maximize reach across our rural state. I mentioned in-person opportunities, and we do intend to provide some in-person opportunities. We know that that can be difficult, especially for our rural hospitals and clinics and rural organizations. It's hard to pull from a small pool of staff to go to a training event, but those in-person events are also super important early on, just because it gives people the opportunity to get to know each other, and also importantly, to learn and network together and to ask those questions and to sort of build that understanding together. To the extent possible, we will record those in-person events and place them on our learning management system for later viewing. But we envision having online trainings also, and a fair amount of learn at your own pace modules. that will have written materials and toolkits and templates and all kinds of different resources that you'll be able to use. The topics for the technical assistance that we provide are intended to span the full cancer care continuum. So it'll include things like hub and spoke models, tele-oncology and telehealth integration, patient navigation and survivorship, care coordination, data use, continuous quality improvement, workforce retention and recruitment, financing and sustainability, and also using community health workers when possible. The offerings are really intended to sort of balance the cancer-specific content also with the broader organizational change and development needs that our system is going to be moving toward as we all embrace this new hub and spoke model of care. I would like to say that if you have ideas about needed education and technical assistance, please share those with us. I've got my email on the screen and I can drop it in the chat in a minute here too, but we've been talking to people in Iowa and we've been talking to folks across the country about topics that might be most helpful as we build our system. And we really want to hear from this audience. You all are the Cancer Consortium and you have your thumb on what's happening in Iowa. So if you can share with us if there are specific needs that you think should be addressed, just please send me an email and let me know what those are. And I'll make sure that they get forwarded on to our team. We do have many requirements and metrics to meet, which will help to indicate impact from our project. There's a strong emphasis on evaluation and continuous improvement. Our success is measured through a number of indicators, including, but not limited to, the number of participants, the geographic reach, participant satisfaction, knowledge gain. So for example, did the session or the meeting or the thing that you participated in, did it really help prepare your organization to implement this new model, as an example? We really want everyone to be a partner in this with us. So we will be using what I call rapid feedback tools like post-session surveys and other real-time items, maybe some Mentimeter questions, things like that. Again, just to allow us to get that real-time kind of feedback so that we can course correct if things aren't meeting people's needs. And the other thing that, of course, we'll have to do as part of this is attend required meetings with Iowa HHS and CMS for monitoring and audits and those kinds of things. So going into phase 2, key deliverables. Well, actually, I'm not going to talk about deliverables yet. Hang on. Let's talk about what phase 2 looks like. So phase 2 is really about offering more customized support to those selected hub and spoke awardees. So the phases kind of overlap. Phase 1, which is more of a public facing sort of foundational learning opportunities, those opportunities will continue to go throughout the length of the project. But phase 2 is really kind of narrowing in on those specific hub and spokes. And so we will use in-person sessions as well as virtual meetings and content from our learning management system to offer that technical assistance. We're also considering offering some technical assistance through affinity groups or communities of practice is another name for those types of learning opportunities, which really kind of allows for more peer learning and relationship building as at the same time you're sort of identifying and busting down those barriers. I would equate kind of phase 2 as looking similar to how, if you've had experience with the Iowa Cancer Affiliate Network, we have some technical assistance sessions that we offer to our ICANN hospitals, and they really are site-specific meetings that allow the site to work on topics that are most important to them, and that's how we kind of move the sites forward with the areas that they need the most help with. So it's an opportunity for the site to really participate with us. Some of the topics are listed on the slide. So again, hub and spoke infrastructure and workflows, navigation, survivorship, non-clinical supports, financing, and sustainability will be a big part of this as well. And then getting into the deliverables for phase 2 for us as a contractor, we have a set of action items that support long-term sustainability and that we are responsible for delivering to the state. One of which is to complete a needs assessment for each hub service area. And then also with the hubs and spokes, of course, to write implementation plans that have milestones and for accountability purposes. We're going to be responsible for creating and making available a number of clinical protocols and tools that include legal and clinical templates, toolkits, resources, additional materials, things that can kind of be picked up and used right away by the hub and spoke system. We also plan to use the COC standards as a guide so that if a rural hub and spoke desires to explore rural accreditation, for example, they'll be already working with just that one set of standards. And of course, we're responsible for ongoing evaluation, data reporting, and submitting a number of outcome reports to ensure accountability and learning. So that's all that I have for slides. Like I said, it's a very high-level overview. I'm, like Lindsay said, I'm willing to answer questions. Again, I would remind you to send information if there are things that you would like to see us you want to make sure that something's in that technical assistance offering, I would go ahead and send that. And I also just want to say that the College of Public Health, the Holden Cancer Center, and the University of Iowa Hospital are all super engaged in this project, and we are all very excited to be able to partner with all of you on this really important work that's happening across our state. So thank you.
Thanks, Vicki. We have had some questions that have come through for some of our panelists. The first one is for Lindsay and Stacy. How many public health departments have signed on?
We have 62 public health departments.
Great.
Some of them covering multiple counties, but yes, 62 so far.
Wonderful. And then this is another question for you. Can you talk a bit more about the follow-up colorectal cancer screening? And is it available for undocumented individuals? Do you anticipate having sufficient funding for and underinsured folks through the
Sure.
project?
Stacey, do you want to take that one?
Sure, yeah. So the focus for that is going to be on uninsured. And so the focus is going to be on uninsured Iowans across the state. We're still working out a little bit of the details in regards to how some of that funding will be able to be pushed through, but we are going to be providing out fit tests that public health will be able to hand out. From those tests, we'll be using a lab for those tests. So we're working with some individuals to identify the best option for a fit test that gives the most accurate readings possible. And that's used through a lab that our medical providers across the state will recognize. And so working through some of those details, but we will then be able to have funding for those that are uninsured to be able to have a follow-up appointment with a medical provider. And our local public health will be working to kind of help coordinate those efforts because we want to try to make it so where individuals are more likely to actually attend that follow-up appointment. We know there's many barriers that are associated with that. And so helping in that care coordination piece and eliminating those barriers to get individuals into the hospital or into the medical provider to be seen.
And the grant funding will provide financial assistance to 100 people to have those follow-up visits.
Great. Just a reminder, if you do have any questions for either Stacy, Lindsay, or Vicki, you can please put those in either the chat or in the Q&A function. This is going to be for all the presenters. Since your projects are just getting underway, what's been your primary focus so far, whether it's relationship building, planning, data, or infrastructure, and why did you start there? Vicki, do you want to start?
all of the above. It's really been kind of a baptism by fire kind of thing because things are moving so fast. And so I don't know if Stacy and Lindsay feel this way, but it just feels like a whirlwind. So we sort of had some plans. Of course, as you're writing for an RFP, you sort of develop some of that. But I think we're mostly building relationships, of course, and then trying to get our ducks in a row to make sure that what we are kind of envisioning as the correct offerings are really the correct offerings, which is why I was asking for your feedback. If there's any points of interest that you would like to see in the offerings. And I think we're just really trying to spread the message too that what we're offering is not set in stone. We really are going to make this tailored so that it fits what the state of Iowa needs. And so with that comes a little bit of sort of flexibility to the degree that you sort of can't nail down your plans exactly right now because we want to keep that flexibility available. So we're just taking it all in right now.
It's certainly a lot to take in. And having undertaken large projects like that before, I feel where you're at. Stacy and Lindsay, how about you?
I think I would echo a lot of what Vicky said. Yes, the relationship building. I've been very clear from the beginning that this is something that we can't do by ourselves, nor do we want to. So we have been blown away and very blessed by everybody that stepped forward to help us, whether it be a public health department or another organization that has some insight or information. So we're very thankful for that and continue to build those partnerships along the way.
Thank you. Rural communities often have limited capacity and many competing demands. As you look ahead, what challenges do you anticipate, and how's the Healthy Hometowns funding helping you think differently about addressing them? And that's for both all three speakers as well.
Yeah, I can kind of take that one to start. Every rural community is different, and we want to not make it a one size package fits all, but to be able to meet some of those limitations in those rural counties. We really want to look as the state as a whole as we bring on individuals to do mitigation and those kinds of things that we're spacing those out. So we're increasing coverage. So the goal is to have coverage across the state. We also know that some of those rural capacities, even in our public health, many of our public health departments are, very limited staff, but we want to empower anybody that's able to from that public health. They know their constituents, they know their individual community members. So making sure that we're capitalizing on that and best meeting individuals' needs.
I think from a technical assistance perspective, a lot of times educational offerings are offered either in person or virtual, and they're offered live. And I think what we're really trying to do is to provide still individual in-person kind of opportunities as well as virtual, but also hybrid. Like we're really trying to weave in the hybrid opportunities just because we know that it is hard for organizations that are small who have so many competing demands. The first of which is probably caring for patients, which is where we want them to be spending their time. So I think that's one of the things that we're really trying to look at, and we're really trying to understand how we do that well so that if you're not in person, if you're hybrid and you're kind of paying attention on a screen, do you feel engaged? Are you also getting the same information, the same engagement and sort of interaction with the material and with the speakers and the presenters so that everyone is learning together? Or does it feel like it's a little less than, which is what we don't want? So I think the funding has helped us to really sort of understand and to apply, again, that flexibility to the learning as best we can with this new opportunity.
And as a follow-up to that question, and those are great answers. you've all touched on this some, but are there other ways that folks in this network can support you in the background on that? You have 100 plus cancer control partners who are here on this call today and want to see you succeed. Um, so how can the network support you? Anyone want to?
I can start if you want me to.
Great.
I I think that this network is invaluable when it comes to our project because there's so much knowledge right here in the network. And I would say if you want to be involved in this, please reach out to me. We're going to be reaching out for um, experts, for subject matter experts. We're going to be reaching out for additional ideas. We're going to be reaching out to help us disseminate the opportunities and to encourage participation. And I really view the Cancer Consortium as a true partner with us in this effort because it's so important for our state. And I think there's just a multitude of ways. I can't necessarily list them all, but I envision reaching out and interacting more in the future.
Thanks, Vicki. Stacy or Lindsay, anything to add?
Sure. I think for us, a lot of it is getting the word out. We've got what feels like an abundance of radon tests and colorectal fit tests, and just getting the word out where those things will be available. And then, sort of as a check and balance, if we are saying something or doing something that doesn't seem quite right, just reaching out to say, maybe try this, or maybe you should head in this direction. We are definitely open to feedback like that as well.
Great. And there's some nice things that are happening in the chat there about this that, from the consortium standpoint, we're happy to share periodic updates with membership whenever you'd like via email or newsletter. And Cindy commented that there's a lot of folks that are doing work in urban areas, but that they are supporting many rural local partners and that they're also willing to support. So even though you're focused in rural, that urban partners want to help out too, if they can. So
Great. Thank you.
yeah. Just as we keep going, if you've got questions, you can put them in the chat or into the Q&A. I've got another one here. As your projects are getting underway, are there ways other rural communities across Iowa could support or lean alongside you as this work develops? And that kind of is the similar question to the one for cancer control partners, but what are you looking for with rural communities specifically? And Stacy or Lindsay, do you want to start this one off?
Sure, I can go. I think kind of what we're looking is just, those additional partners, if they're wanting to come on, the information for their county, if there's, ideas of where things should be shared or gaps or information that they know of certain populations that maybe aren't being touched, that, there's different ways for us to be reaching out, and then again, as Lindsay said, just sharing our information, so people know where to access, items, as they come out. So that we, increase that awareness.
Thanks. Vicki, do you
I
have anything
would
to add?
echo what Stacy said. I also know that there are a number of, maybe I call them programs within programs. So many rural hospitals and clinics have little programs that they operate in their own little area, and they're not necessarily well known, but I would be really interested to know where those programs are and how they are benefiting your populations, because this is an opportunity to sort of like bring those things to fruition as far as like disseminating those to others and providing those ideas to the broader network across our state. And I feel like our project is a way to do that. So if you have, like I said, those little projects that are you're finding successful within your population, if you would want to share those, it would be a great opportunity to bring those things to a broader audience and see maybe it can be upscaled or at least brought to other organizations throughout the state.
Thanks. I know that getting getting a big project like this underway is exciting and sometimes overwhelming. And I'm curious, just what are you what are you looking to? I can't talk today. What what are you most looking forward to with these projects? Sorry about that.
I think for me personally, especially right now, cancer is being talked about everywhere. You know, it's in the news, it's in conversations we're having. It's definitely a hot topic throughout the public health in our state. And I think just um, joining together and supporting our communities. It's a scary thing and a very vulnerable place in people's lives. And so I think just being able to support them and to be there for them and offer some answers and hopefully some solutions, I think would be very helpful.
Yeah, how about you?
We, just signed our contract not even 2 weeks ago. And so there's still a lot of what I would call organizational setup that's happening, kind of the boring stuff, if you will, like getting the accounting process ready and getting all of the LMS ready and those kinds of things. But I'm looking forward to mostly right now is our first in-person gathering or our first opportunity to kind of kick this off to the state at large and just really feel like the work is starting and launching. Like that's what I'm really looking forward to right now, just to get to that point of really launching it, like feeling like it's being launched.
I do have another question that came up. It says these rural initiatives sound great for adult Iowans with cancer, but what initiatives exist for kids with cancer? From your perspective, Vicki, do you want to touch on this one first?
It's always so hard, right? And I am in that bandwagon. I have a grandson who was diagnosed with cancer when he was 6 months old and ended up having to have his foot amputated because the cancer was super aggressive. So I feel that pain wholeheartedly. I think that many of the cancers that are driving our cancer rates, it seems, are those cancers that are adult based. So prostate cancer, breast cancer, things that kids just don't get. And I think part of the issue is that because that's what's driving our rates, that's what's also driving the interventions that we're trying to implement across our state. I hope that through this process we can really also develop some processes and some protocols and some needed interventions, whatever it is needed for kids. I just don't know that is right now. But I also think there are others who are working on some of that also. So I think part of it is just sort of figuring out who owns that and who should own that and kind of building from there.
Thank you. Lindsay or Stacy, do you want to bring us home?
Yeah, either way, Stacey, sorry, I thought you were going to say something. I echo a lot of what Vicki said as well. So this project for us is focused on adults, but we would be very interested in definitely championing a program for children as well too. It's very much necessary.
Stacy, did you have anything to add?
Yeah, I think just the part that we know that these initiatives are focused, kind of a little bit more on adult households but it's kind of as Lindsay said, we don't want to, we do know, I saw Scott put in the comments, 22% of Iowans are kids and, these can be beneficial. Kids are in these Iowas on the homes that we're looking to address, but at the same time, there are lots of unique factors that impact kids and unfortunately, many of us probably on the call all know a child that's been affected by cancer and how devastating that can be, not only for the child, the immediate family, but also kind of that community that rallies around them. And so, not, underline that those are needed concerns for future work.
Yeah. Thank you very much for that Q&A. And I think that's where we're closing in on the end of our time together today. So as we move forward, I'd like you to please help me thank our speakers, Stacy, Lindsay, and Vicki. Great job, and we'll look forward to hearing more from you in the future about how your projects are going. But hang in there. I know that you've got a whole group of people behind you cheering and supporting and wanting to help in any way that we can. So thanks for joining us today. Kelly, I'll turn it over to you.
Thank you. And thank you so much, everyone. This is so much great information to digest. I think we can tell from the comments in the chat that there are going to be partnerships made. And that the staff is always here to help you facilitate those partnerships, to help you make connections to resources. Thank you for being part of this network, as always, for what you do in your communities and your organizations, for our state. We are grateful to you as leaders in this work, and your willingness to not only just do your work, but also share it for the greater good here in our state. We would love it if you would take just a moment to complete our brief evaluation, and the link has just been dropped into the chat. As I know I tell you all the time, we really do take this feedback seriously to help make sure that our events are focused on things that are helpful to you. So please take a moment to complete that evaluation. And speakers, please, again, look back at all the love in the chat for you and the work you're doing. Keep doing it, and let us know how the consortium can help. And I know Rachel and I will hang on for a few minutes, and Megan, if you're able, in case anybody has questions about anything consortium related or wants help making connections, you are welcome to stay on and chat as well. Otherwise, I'm sure we will see most of you on the internet at another time soon, and then eventually again in person for our next conference. Thank you, everybody. Enjoy the rest of your day.